right, so this is block 2 skills. We are doing an IV insertion, flush, and discontinue. As you can see, our model has fingernail polish, which would not be permissible in lab or clinicals, but it is the end of the semester, so at this point we will pretend as if she does not have fingernail polish. All right, you may begin.
Standard protocol for reviewing physician's orders, patient ID, and explaining procedure.
Alright, so you check the orders outside with the computer to make sure that there is an order to start an IV, and then gather your supplies and head on into the room. So these are the supplies that are needed. Alright. Hello, my name is Victoria. I'm your student nurse today, and I'm here to start your IV for you. We're just starting it in case you need fluids, any IV medications. Can you just state your name, birthday, and any allergies you possibly have?
Joan Smith, 85XX, and I do not have any allergies.
Okay, perfect. This is going to be a really quick little procedure. It won't take too long. So let me get everything ready and we'll start, okay?
Okay, thank you.
Gather equipment, IV start kit with tape, gloves, IV catheter, extension set, 3 to 10 milliliter syringe with saline flush. Apply tourniquet to upper arm and choose appropriate vein.
The tourniquet is in the start kit. It sometimes rolls around. Today it's in the tape. Alright. Oh, make it a little tighter. Alright, tourniquet on. And selecting a vein. We'll go with this one.
Remove tourniquet. Prepare equipment. Prime injection cap and extension with normal saline. Loosen end cap.
This is the extension set. Right here. Normal saline syringe. Pop off this white piece. That goes to the trash. Connect it to this bluish purple piece, and then you can keep this on, just loosen it up, and then slowly flush. It might take a little pressure to get the saline moving. There, oh, the cap came off, but you can either put the cap back on or leave it, this part, in here as long as it stays sterile. Alright. Ready to go.
Place chucks or towel under arm.
This will be a towel today. There you go.
Don gloves. Cleanse site in up and down scrubbing motion with ChloraPrep for 30 seconds.
Alright. Glove. Hand hygiene before gloves, everyone. Hopefully it dries. That was a lot of hand sanitizer. There we go. Gloves. ChloraPrep. It may look different depending on the kit. And then crack it and on your vein. Oh, there we go. Alright, and then on the mannequins, the ChloraPrep will not dry, but on a person, it will dry. So do not worry about it for it to not dry.
If patient is sensitive to chlorhexidine, cleanse site with alcohol in circular motion, moving outward with intended insertions within intended insertion site. Apply tourniquet. Open catheter and inspect for flaws. Keep catheter sterile.
Catheters in here, no flaws.
Stabilize vein with non-dominant thumb and insert catheter bevel up.
Okay. Bevel up.
After blood flash, advance entire device using index finger of dominant hand or thumb/finger of non-dominant hand. Slide catheter off needle into vein up to hub. Use finger tab if available. Avoid touching open end of catheter.
Alright.
Keep needle in place to prevent excess blood loss. Remove tourniquet. Stabilize hub. Apply pressure to vein with ring or middle finger. Quickly remove needle and attach extension set to catheter. Aspirate for blood. And then flush catheter with 3 milliliters of normal saline. Observe for swelling, pain at site, then place transparent dressing over site and secure.
Alright. Oh, this way, right? This is harder than I thought it was going to be. I'm not used to that way. I got my blood.
Just be cautious not to have your hands over the site in the cleansed area.
Okay. And then just on it. Like so. Remove this part.
Label site with time, date, gauge of needle, and nurse's initials.
And tape the hub. And then label it.
Verbalize only 2 IV insertion attempts.
1 attempt.
Document insertion site, IV catheter gauge used, and patient's tolerance to procedure.
Right forearm, 22 gauge, and patient tolerated well.
Alright.
With the blood that's in the tubing, go ahead and flush that as needed to clear the line. And clamp.
Done?